Hello, everyone. I'm Kelly Flanagan, the Clinical Director at Florissa Pediatric Development Center, and I'm here with Dr. Laura Gumbiner, who's one of our child psychologists and a school psychologist as well. April is Autism Awareness Month. Autism Spectrum Disorder, or ASD, occurs on a spectrum, and that means that there's wide variation between individuals in the severity of symptoms and then the impact of these symptoms on kids' daily living. This variation can make accurate diagnosis really difficult. And so to make sure that children with autism are not missed in getting a diagnosis that can help them get the services they need, and to make sure that children are not misdiagnosed as having autism when they actually do not, the evaluation process is extremely important. And tonight we want to share with you some common questions that we are asked about how we diagnose autism. All right, so the first question we're often asked is, how do caregivers know if their child should be considered for an autism evaluation? And that's a really good place to start. So the American Academy of Pediatrics recommends that all children get screened for developmental delays and disabilities during their regular well-child doctor visits. All children should be screened specifically for autism during their 18-month and their 24-month well-child visits. The screening's typically done when a caregiver fills out a brief questionnaire or if the physician asks questions about the child's development. The questions look at different areas, including how the child communicates with their caregivers, both verbally and non-verbally. So then, Laura, I then am often asked at that point whether these screening tools provide a diagnosis.
Well, the answer is no. So based on the short screeners, a diagnosis cannot be given. Instead, the next step would be a more comprehensive diagnostic evaluation for children who display some symptoms based on their developmental level. So for example, kids with autism, and of course it's a spectrum and it varies, but they may find it difficult to connect, so to speak, with other people, have a hard time kind of reading social cues and picking up on social interactions. They might have inconsistent eye contact or difficulty engaging in make-believe play, difficulty with back and forth conversation. They might not begin to speak as early as other children, or they may have odd ways of talking. Children with autism might rock their bodies back and forth. They might repetitively repeat phrases or become extremely upset when there are changes in their routines. So they're often deeply interested in a particular subject, and they often also typically have sensory issues. One of the questions that I'm often asked is if a child is older and already in school, what should we think about then? So sometimes symptoms of autism are not noticed until a child goes into daycare or school setting. Adults there might notice that the child is behind developmentally compared to other kids their age, or that the child is not interacting well with the other children, or perhaps they're displaying repetitive odd behaviors, or just really struggling with changes in routines, transitions between activities. It's common that a teacher or a daycare provider might recommend supports or services to help the child within the setting. However, if a child is eligible for services due to autism symptoms, school staff cannot provide a medical diagnosis of autism. That needs to come from a comprehensive diagnostic evaluation.
That's right. So once an evaluation has been recommended, then we're often asked what a comprehensive autism evaluation includes. So what is that actually? Well, the purpose of an evaluation that is comprehensive is to confirm whether a child has symptoms of autism. So that's the basic, most foundational purpose of that evaluation. If a child shows symptoms, we then ask how those symptoms affect the child's functioning in their everyday life. And the key areas that we want to assess are language and communication, social awareness and interaction, and then restricted interests, repetitive behaviors. And those are the symptoms that fall under autism. Autism's best diagnosed with a multidisciplinary team. And what that means is that there are trained professionals from different disciplines who have expertise in working with kids with autism. Team members may include a speech-language pathologist, an occupational therapist, a developmental pediatrician, a child psychologist, or other specialists. So how are symptoms actually evaluated? Well, within a comprehensive autism evaluation, we want to include many different pieces. So the evaluator should first gather information from interviews, questionnaires, their own observations of the child's behavior, and then from formal testing. So there's a whole bunch of different things we're doing in order to get that comprehensive nature for this evaluation. Caregivers are interviewed about their child's development from birth to the time of the formal testing. And then we obviously focus on symptoms of autism with that interview. The interview will also explore other aspects of development, and that may be pregnancy and birth history, health history, their school, their academic history, and other details that could affect a child's development. It's also helpful to interview the child's teacher or any other adult who works with them, like a daycare provider, as Laura mentioned. And that's really so we can better understand how the child functions across settings, so in different environments. The child will then be observed by a trained evaluator who can determine if symptoms of autism are present. Caregivers and other adults who work closely with the child will be given questionnaires. So we do get that input, and we ask them about their child's behavior and functioning in real life settings like home and school. And then the evaluator will also meet with the child and administer formal tests of autism.
Mm-hmm. So many times we get asked if there is a specific test for autism, and it's very important to know there's not a specific test, and there's not one specifically required for an autism diagnosis. However, sometimes that gets a little muddy with insurance. The gold standard typically is for trained professionals to use a test called the Autism Diagnostic Observation Schedule, also known as the ADOS for short. So this test helps trained evaluators make objective ratings of a child's behavior while playing with toys and engaging in activities and maybe talking together. The activities really provide the evaluator an opportunity to observe a child's social and communication skills and any repetitive behaviors that happen frequently. The observations then help the evaluator determine whether the child's behavior pattern suggests a diagnosis of autism. It's also a common question, what are other areas that are evaluated during a comprehensive autism evaluation? Because autism is a developmental disability, the evaluation typically includes tests of language, intelligence, sensory processing, and daily living skills. A good evaluator will really consider all of these areas and other problems that the child might be having that could be causing some of the symptoms or that could look like autism, but in fact are not. So for example, ADHD or intellectual disability, anxiety, or a language disorder. Depending on the child, the skills that the evaluator should assess could include inattention or attention, memory, emotional functioning, and motor functioning. So evaluation of these areas isn't necessary for an autism diagnosis. However, the additional information could really help to understand that particular child's level of functioning and help guide treatment decisions for that particular child. Skilled evaluators will always consider other diagnostic explanations that may explain the child's current functioning, and it's really important when you get an evaluation that that is considered. The evaluators will also consider conditions that might happen along with autism that could be affecting the child. So Kelly, could you give us some examples of some of the other explanations or conditions that might be there for autism?
Absolutely. And I think that's one of the biggest purposes of that comprehensive evaluation, is that we want to make sure we are not misdiagnosing or that we're not missing something else that could be affecting a child's functioning. So evaluation of genetic disorders and other medical conditions that might be associated with autism is necessary. We want to rule out that there's a possible medical cause for any of the child's difficulties that they're experiencing or that adults are concerned about. Adults may be concerned that a child who is anxious and keeps to themselves and does not interact with other kids in a skillful way, they might think, oh, that child has autism. Similarly, many children with ADHD struggle with their friendships because they've missed out on opportunities to learn social skills because of their difficulty paying attention to what's going on around them or controlling their impulsive behavior. And so again, these kids may also look socially immature. And so a question about autism may come up. Children with intellectual disability oftentimes prefer routines. They may show repetitive behaviors, and that could be because it just helps them understand their environment and not because they have autism. So these are just some of the many things we look at when we're evaluating children. And then also, by looking at other conditions, we can identify interventions that may help the child function better, such as getting better sleep, communicating effectively, or feeling less anxious.
So you may be wondering what happens after an autism evaluation. So caregivers meet with the evaluator to receive feedback. And the evaluator at that time reviews the results from the evaluation, explains any diagnoses and appropriate treatments, and ways to help the child at home and at school. The family should receive a written report about the evaluation that includes recommendations and resources to support the child. And typically, the evaluator will help connect the family to agencies who can provide ongoing support for the child. So another good question would be, where do caregivers receive this type of comprehensive evaluation? So here in our local community, Florissa, which is the Children's Division of Crider Services, provides comprehensive multidisciplinary autism evaluations for children and adolescents in northeastern and north central Illinois. Florissa is part of the Autism Program, or TAP, of Illinois Service Network, which is a collaboration of 4 universities and 11 organizations, which operate 20 centers across the state to provide the services. Without Florissa in our local community, families would have to get on a lengthy wait list. I mean, that could be up to a year or two, and travel further distances like Chicago, Peoria, Iowa City, just to obtain an evaluation.
So best practice in autism evaluation does take a comprehensive approach with professionals from different disciplines, and with that intent of best understanding a child's skills and needs. And a comprehensive evaluation gives families a better understanding of their child's strengths and any challenges. It really should provide caregivers with direction about individualized treatments that will benefit their child. And with this information, they can then go on to build a supportive care team with providers and school staff and family members to help their child grow.
We really hope that this video has been helpful to understand the evaluation process for autism. Please do give us a call at Florissa if we can be of any help.
Thanks.
Thank you.